Hi, thanks for joining me again. Today, on this episode of The Present Mind, here on MCTV, we will be speaking with the Alzheimer's Association of Trinidad and Tobago. It is currently September, and we are celebrating World Alzheimer's Month. And this is an issue that affects very many of our elderly population. So we would like to try to highlight it today and bring some awareness to this situation. Alzheimer's disease is one form of dementia. Dementia means loss of memory or loss of cognitive abilities that affects our ability to function. It is named after Alois Alzheimer, who was a German neuropsychologist who first described it. Alzheimer's disease is a progressive illness. It can start off mild, but then it progresses to moderate and severe forms. In the mild stage, it can be as simple as forgetting things that happened recently or asking questions repeatedly, sometimes leaving the kettle on the stove for an extended period of time. In the more moderate stages, there can be changes in personality. They can start to wander away, they can become agitated. And in the more severe forms, the person is unable to help themselves and can even become bedridden. It is very important to note that Alzheimer's disease is not a normal part of aging. It is a pathological process where the loss of memory is more than would be expected, and the loss of mental functioning or cognitive functioning is more extreme than would be expected. There are no specific tests to confirm that it is Alzheimer's disease. What we recommend for patients who have these symptoms would include blood tests to rule out things such as vitamin deficiencies or anemia, and even imaging tests such as a CT scan of the brain or MRI of the brain to make sure that this isn't being caused by a stroke or a tumor. The only way to diagnose Alzheimer's disease for sure is after death at the post-mortem. Additionally, there is no cure for Alzheimer's disease. However, there are several treatments that can slow down the progression of the illness to allow the person to have many more years of adequate functioning. Oftentimes, persons with early stage Alzheimer's disease, the illness is not picked up because the symptoms are very subtle, and persons think that, well, it is just the normal result of the aging process. However, I would like to go through some of the common signs of the early Alzheimer's disease so that you will be more aware of it and may pick it up in your own relatives or those that you care about. They would include memory loss, loss of spontaneity, taking longer to complete their normal daily tasks, repeating questions over and over, trouble handling money or paying bills, hiding away things and forgetting where they've put it. Sometimes they may wander away and get lost. For instance, if they're accustomed going to the market, they may go to the market but be unable to find their way back home. They may lose things or put them in odd places, and you may notice changes in their personality and that they are becoming more anxious and worried. Alzheimer's is caused by the deposition of proteins within the brain that happens naturally as we get older. But in Alzheimer's patients, these deposits are in greater quantity and they happen in specific areas of the brain that affect memory. It is very important to try to prevent Alzheimer's disease or other forms of dementia. So how would we do that? Well, first of all, we would start by having as healthy a lifestyle as possible. Eating well, sleeping well, exercising, staying away from alcohol, staying away from smoking, managing chronic diseases such as diabetes and hypertension, as well as trying to keep mentally engaged through doing crosswords, having discussions, playing a musical instrument, learning a new language. These are all things that allow us to keep our mental faculties longer. I would like to give some tips now specifically to the carers of persons living with Alzheimer's. Alzheimer's is a chronic disease that can last for many years, and it can be a frustrating experience at times. However, hopefully these tips will be able to help you to manage better. So, reduce frustrations for the client. For example, persons with dementia might become agitated more easily due to challenges. Schedule-wise, it may be easier to do certain things such as showering and changing earlier in the day while the person is well rested. Take your time. Anticipate that it will take longer than normal for them to do activities and schedule accordingly. Involve the person as much as possible, allowing them to do what they can to allow them to preserve a sense of self-efficacy. And provide choices, but keep it simple. So you can give two choices. For example, would you like something hot to drink or something cool to drink? Rather than just saying, what would you like to drink, which can be an overwhelming question with a lot of different answers. Keep your instructions as simple as possible. Limit napping in the day, try to get them to sleep in the night. And reduce distractions. So during meal times or conversations, turn off the television or the radio to allow them to focus better. Be flexible. For example, if a person has a particular outfit that they like to wear, perhaps try to get several of that outfit so that it will be easier to get them dressed in the morning. And if they are giving trouble to bathe, consider having them perhaps shower less often. It is very important to create a safe environment. Put locks on cabinets with things such as chemicals, toxic cleaners, guns, matches, and so on. Prevent falls as much as possible. Avoid rugs on the ground. Put handrails in the bathroom. Check the water temperature and check the thermostat on the water heater to avoid them getting scalded or burnt. Remember that each person with Alzheimer's disease will have individual needs and will need individualized care. And finally, please practice self-care of yourself as the carer to allow yourself not to become frustrated or burnt out. Get help from family members or friends or other social services that may be able to offer respite at times. So we're going to take a break now, and when we come back, we're going to have our guests from the Alzheimer's Association of Trinidad and Tobago. Please stay tuned to The Present Mind here on MCTV. Welcome back. Thanks for joining me again on The Present Mind. Today, I'm very lucky to be joined by the executive of the Alzheimer's Association of Trinidad and Tobago. We have the president, Ms. Michelle Clavery, the vice president, Ms. June Holdip, and the PRO, Dr. Leanne Conyette Brown. Ladies, thank you very, very much for appearing on the program today. We appreciate you taking the time to come.
And thank you for having us.
So, Ms. Clavery, why don't you get us started, and you can tell us a bit about the association itself and the organization and how long you've started the organization.
The organization, how it began and so on. Okay, good. So thank you. I'll just give a brief history. Our association is 21 years old. We celebrated 21 years last June 16th. The association was started, as I said, 21 years ago by one Mrs. Norma Innes. Norma had belonged to the Soroptimist Association. She is our first president, and she began this association, as I said, 21 years ago. At that first meeting, she presented a seminar entitled Alzheimer's Disease, the Affected Person and the Caregiver. And from that first meeting, support groups were started. We have support groups in the East, in Arima, we have in Tobago, we have in the South, and we have in the North, 4 support groups. As of, well, not as of today, but ever since COVID, we have not been able to meet in person. So we try to do virtual link-ups with our support groups, okay? In 2000, the association registered as a non-profit organization. Our patron is Mrs. Angela Piddock, a well-known journalist and avid supporter of organizations with a cause. ACTT also formed a partnership, and ACTT, of course, the abbreviation for Alzheimer's of Trinidad and Tobago. ACTT formed a partnership with the Alzheimer's Society of Canada, ASC, in 2003. And we became a full member of ADI, Alzheimer's Disease International, our parent body, if you will. We became a full member in 2004. Our former president and Prime Minister, A.N.R. Robinson, he was our first patron, and he remained a patron until his passing. Now, a little about some of the presentations that we did, or have done, so to speak. We did a joint presentation at the first World Summit Symposium on Elder Care Mediation in Ottawa, Canada. And we did that presentation with Alzheimer's Canada as well. And in 2007, in partnership with ADI, ASDATT hosted the 4th ADI non-Latin Caribbean Conference on Alzheimer's and other dementias right here in Trinidad and Tobago. At that conference, the Alzheimer's Association of the Caribbean, because there is that association was launched, and of course, we are part of that association. So in brief, that's what I would say, so far about the association. I mean, we have core values and so on. I don't know if you want to switch to something else, so I can tell you about the core values quickly. Our core values, we're built on 6 core values. That is support, empathy, trust, respect, sharing, and integrity. Okay. I will pause there for a little bit and see, if you, want to say anything else, really.
Well, I'm very interested in hearing more about these support groups. The support groups are, I presume, for the carers rather than the persons with dementia, or is it for the persons with Alzheimer's themselves?
Okay, so, but somebody else, June or Leanne, I mean, the support groups, they're basically for the caregivers. Now, sometimes the person who's living with the disease, and we are very guarded when we talk about persons, we don't say again, suffering. People used to say suffering from Alzheimer's. We say they are living with the disease, because that is what happens. So June, do you want to say a little bit about the support groups, maybe?
Okay.
Mm-hmm.
Hi, welcome. Good evening. Good afternoon, sorry. Yeah, the support groups, as Michelle said, there are 4 support groups, one in Port of Spain, one in San Fernando, one in Arima, and the other one is in Scarborough, Tobago. As Michelle indicated a while ago, traditionally the support groups met at least once per month. And at each meeting, it's an opportunity for caregivers in particular and other persons who are interested in helping out with Alzheimer's. When we meet, we discuss, persons are allowed to share their challenges, and there's an exchange of ideas, exchange of information, which other persons feel might be useful. And we're always guided to add a caveat that it worked with me, you can try it, it may work with you. In addition to that, at support group meetings, there's also an opportunity for persons to be educated some more about the condition. So sometimes we have speakers from within the organization, and sometimes we have external resource persons who will come in and do some educational presentations. Through the support groups too, we have been able to do some in-house training, in-house education as well as training. And when we talk about education, it's not only, well, it is related to helping the individual who is living with the condition. So it would be traditional education, for example, how best can you communicate with those persons? What are some of the strategies you can use? It could be education in terms of healthy eating, food preparation. It could be education in terms of alternative therapies, for example, aromatherapy. It can be education in terms of activities that can be done to engage the individuals who are living with the condition. So these are examples of some of the activities that take place during support group meetings.
Yes, yes.
So I heard you mention alternative sorts of therapies. Something that we see advertised very frequently is fish oil supplements and omega-3 supplements for inflammation, for arthritis, and also for dementia and Alzheimer's. What do you think about fish oil and omega-3 supplements for Alzheimer's disease?
I would let our resident doctor say something about that. Leanne, you want to take that, because we're very careful about these alternative treatments.
So one of the first things I would like to say is that there's no treatment for dementia, no Alzheimer's disease. But what we do as healthcare professionals is that we manage the other symptoms that the person presents with. And the advantage of doing that is that they can improve the quality of life. So for example, someone with dementia, I'm just talking about the umbrella term of dementia here. It can affect their memory, and it can affect their learning and their thinking and their comprehension and even their judgment and their behavior. So for example, we may give them medication if they have difficulty sleeping at night, or medication if they have hallucinations, medication if they have agitation. So we manage those aspects. We also manage their comorbidities. For example, if they have any diabetes mellitus and hypertension, we follow evidence-based guidelines. But I want to stress right here that there's no treatment available for dementia as well as Alzheimer's disease. You'd have known, you have seen, I think a few months ago, where the FDA approved an Alzheimer's drug, a new drug. I think that was in July, around July 20th. They approved a new drug called aducanumab, which goes by the brand name Aduhelm. It's a monthly intravenous infusion that is intended to slow the cognitive decline in people with mild memory and thinking problems. It's actually first approved treatment to attack the disease process of Alzheimer's instead of just addressing the dementia symptoms. But of course, this is something new. And I remember the list price or the cost price for this drug was $56,000 US a year. And that is in the US, right? So again, I just want to stress, we don't have any treatment available here, but we manage the other symptoms and we manage the comorbidities of persons living with dementia or Alzheimer's disease.
We're going to take a short break and we'll be right back here on The Present Mind. So, we're back with the members from the Alzheimer's Association of Trinidad and Tobago, and I'm going to speak to Ms. Clavery, who's the president. So, Ms. Clavery, as we are filming this, it is September. It is World Alzheimer's Month, and September the 21st is World Alzheimer's Day. I know that with COVID, with the pandemic, the way that it might have been marked or held will be different this year. But are there any plans in place that the association has in terms of, marking the event or doing anything special for the event?
Anything special? Yes. Well, we on September 25th at 5 p.m., we are having a webinar. And the webinar really is going to speak to the theme for this year's World Alzheimer's Month, which is No Dementia, No Alzheimer's. So we are having two speakers, Dr. Avidesh Pandey and Dr. Joyanne Fubab. Dr. Pandey is going to address a continuing webinar that he did with us on yes, managing the symptoms and so on, the whole dementia, all around the theme of dementia. Dr. Bab, an educator, she is going to be delivering on caregiver support as we talk about, of people suffering with dementia. And let me say here as well, that sometimes people use the terms interchangeably, dementia and Alzheimer's. It's what the correct terminology is Alzheimer's dementia, because of course there are other forms of dementia. So Alzheimer's comes under the umbrella of dementia. So yes, that's our major activity we are having on the 25th of this month, and we are hoping people will log on. It's a free webinar. In spite of the fact that we are really an organization, we're a nonprofit, so we also have to do a little fundraising, but we thought that this month we're going to do things gratis because people are really out there needing any information that they can get. So we are doing that. But the next thing we are having, the next sort of major thing is that we want people to look out in the Guardian newspaper. There's going to be a pull-out insert, Health Plus, that will address Alzheimer's disease, and so on and so forth. So those are the two major activities. Apart from that, we are going to have a spoken word poet who is going to deliver for us at a webinar, and really is a webinar not to be missed, because it's going to be chock full of information for anyone out there who is caring for someone with the disease, or who himself, or herself might be in the early stages of the disease. So that's what we're having. Leanne, what else? June, we're having some other items as well. Oh, we are having a pop-up shop.
Yes.
And that we hope people will support, because we are going to be selling masks with our Alzheimer's logo. And this is what the logo looks like, if you can see my t-shirt. Yeah. Yes. And so we are hoping people will donate and contribute and so on. So that's basically, those are the events we are having for World Alzheimer's Month. But it doesn't stop there, because we want people also to get involved, and particularly young people, because we have 4 objectives in mind. And objective 1 is really for to advocate for the disease, and we want young people to help with this as well, because the young people become the caregivers of tomorrow. Some of them are even caregivers now. So the more they can be armed with the information, the better able they would be to cope. So we want to advocate one objective. We want to strengthen the association's financial capacity. We are hoping businesses will also get involved and help support us, because it is really, really a serious ailment. The statistics have shown that while I think it's 7.6% of heart patients, the incidence of people dying with heart failure has decreased by 7.6%. With Alzheimer's disease, there's an increase of 145% of people dying with Alzheimer's. Now, this puts a heavy burden on any society, because the caregivers have to take time out from work, and the caregivers themselves are stressed. And so we want to really encourage businesses to get on board with us. Our third objective is to engage in advocacy initiatives. So I want to say thank you as well for assisting us in that regard, because once this program airs, we are hoping that many people would see it and would want to get involved in the association, because the board, we are a working board, but we are also full-time working people. So it's a little strain for us as well, but the cause is extremely important to us. This is why we are here. The fourth objective is to encourage research. And when you asked about what initiatives we might be engaged in, that is one we have begun talks on, to get statistics, local statistics for our people here about the prevalence of the disease in the country. Yes, so this is where we are. This is where we are. Yeah.
So that's excellent. Those are some excellent initiatives that you're doing. Can you just tell us when and where will be the pop-up shop?
Online pop-up shop.
Oh, it's an online pop-up shop.
Yes, online pop-up shop.
And that will be at the association's website?
Yes, it'll be on our webpage as well as on Facebook.
Facebook, yes.
Great. And it's Alzheimer's Association Trinidad and Tobago.
Trinidad and Tobago.
Yes, yeah. Yes. I want to mention one other thing, Shivan, before we move on. Last year we signed an MOU with UWI Roytech. UWI Roytech, because we are also big on education. That is one of the services we provided, education and training. So we have had 2 workshops, paid workshops so far. We have another one that's going to be coming up in November, I think it is. And I want to say that this partnership with UWI Reutech really gives us a little weight, because at the end of a workshop, you get a certificate of completion, which really furnishes the person who participates with information and guidance and so on, and how to care for. So we think in terms of young people signing up for this. We think in terms of care homes, who very many of them have caregivers who are untrained. And so we encourage people, again, when these workshops come around, to also log on, sign up for the workshops. But that relationship we have there is with UWI Reutech. So they help us in that regard. Yeah.
Well, you're very right that it is essential that we get younger persons involved from early to understand the illness, to look out for the signs of illness in those elder persons that they know. Because one of the things that we see in practice is that oftentimes the early signs of Alzheimer's are missed, or the early signs of dementia are missed, until it is relatively advanced. And then, as you say, we can't treat it or reverse it. So we're just trying to slow it down, but we're already at a disadvantage. So the earlier that persons can pick up that something may be amiss, and the earlier they can be screened and treated, then the better the outcome would be for the persons living with Alzheimer's disease. As we get ready to wrap up, let me open the floor to you. Is there anything else that you would like to share? Anything that is important that we may not have covered so far?
One of the things, I just want to follow up on what you were mentioning before, Shivan, and I think it really is a difficult task to distinguish the early stages of dementia from normal aging due to the gradual appearance of the symptoms. And added to this is that early in the disease, the patient has limited awareness of his or her deficits. The thing about Alzheimer's disease is that it spreads to the brain in a nice characterized sequence. So we can actually have mild, moderate, and severe Alzheimer's disease. And persons can live with Alzheimer's disease for up to 20 years. And Michelle could tell you about that personally.
Yes, my father, that was my father.
Yeah, and the thing is, the first part of the brain that's affected in Alzheimer's disease, or a person living with Alzheimer's disease, is a part of the brain called the hippocampus. So hippo comes from the Greek word horse, campus comes from the Greek word sea monster. So it's a part of the brain that looks like a seahorse. Okay, and this part of the brain is the area that's important in the formation and retrieval of memory. And this is one of the first parts of the brain that's affected in persons living with Alzheimer's disease. So what you may find is that their distant memory is preserved, so they remember everything from long ago.
Yes.
But their short-term memory goes, and you'll find they ask the same question repetitively. These are persons with mild disease. So they forget about the recent conversation. They forget about recent events. Some people are slow at grasping new ideas. They may show poor judgment or lose interest in things that they used to be interested in before. That's mild disease. And persons can be in mild disease for up to 2 to 4 years.
Yes.
And then you move on from the mild disease to moderate disease. And this can last up to 10 years. And in this stage, the damage gets worse. So the part of the brain responsible for language and reasoning and sensory processing and conscious thought, that part of the brain gets affected the most. So they may even have problems with recognizing family and friends.
Even mobility as well, because some of them are unable to walk at some stage.
Sure.
So you mentioned, you were speaking about the signs of moderate Alzheimer's disease.
Yes.
And so I think that we could both agree that by the time the moderate disease comes, most people are beginning to realize that yes, there's something definitely amiss here. It is more in the mild stages that it could be overlooked or taken as a normal aging. So what advice would you give to persons? Let's say persons see this program and they begin to think, okay, I'm beginning to see some of the milder signs. What advice would you give to persons who have family members in who they're seeing these changes?
Sure. Well, the first thing, Shivan, is dementia is not part of normal aging. That's the first thing. As we age, there are changes that occur in our brain. We might lose some cells, the nerve cells in our brain. We might have a decreased blood supply to the brain, decreased ability for messages to be transmitted. But the thing is that with normal aging, even if we may forget something now, we will not get lost in familiar circumstances, and we retain our independence and our ability to make decisions and judgment. That's normal. When the memory or the other cognitive impairment affects the ability for this person to function independently, open your eyes and seek immediate medical attention. You can go to your family practitioner. You can go to your local health center. You can, if you don't know who to go to, you could go on our Alzheimer's Association of Trinidad and Tobago page, where we have the memory clinics available in the hospitals. So it will give you the name of the memory clinics, the location, and the phone numbers. You go and you seek help. When they come to us as healthcare practitioners, we take a thorough medical history. Shivan, you know it would take up to 30, 40 minutes, 60 minutes sometimes, because we ask the patient who's living with the disease, as well as his family, friend, or caregiver, we ask them to explain what they've noticed going on and how long they've noticed these symptoms and how these symptoms affect the activity of daily function. If they can still feed themselves, dress themselves, groom themselves. All these are important. We ask them about their past medical history, if they have diabetes mellitus, hypertension, because we know that there are also reversible causes of dementia. We ask them about if they're vegetarian, what their vitamin B status is like, if they have any history of thyroid disease, what medications they're using. So if you suspect that you have a family member who's living with early stages of dementia or Alzheimer's disease, please seek medical attention.
Yeah, and Leanne, maybe you want to even repeat that, because as you said, and repeat the fact that it may be dementia is caused by any of a number of things. And of course, I'm not here subbing as a medical person by any stretch of the imagination. I'm just an educator. However, we know of people who were experiencing signs of dementia, and the caregiver was assuming it was Alzheimer's, when in truth and in fact, it was simply a vitamin B deficiency. Yeah. You understand? Yeah. So that's why it's important to go, not just to get a diagnosis of Alzheimer's, but to get a diagnosis which can guide you as to what you may need, by way of treatment. And it might be something as simple as a vitamin B deficiency. Yeah.
So I would like to thank you all for taking the time to join me today on the program. I know that it's really a lot to cover, and we didn't have a very long interview, but hopefully in the future we can meet again and we can speak again about ongoing initiatives and how persons can seek help should they need to. So thank you very much. We're going to a short break and we'll be right back here on The Present Mind. As we close off today's episode, I would like to leave you with a thought. One of the hardest things that you will ever have to do is to grieve the loss of a person who is still alive. Unfortunately, for many persons who live with persons suffering from Alzheimer's disease, this is what it feels like. To see a person physically alive, but no longer the same person that you grew up with. Oftentimes, these persons are our parents or our grandparents, persons who were pillars and beacons in our lives. And to see them not be able to recognize us or their grandchildren, or to be able to even look after themselves, can be a crushing experience. Alzheimer's disease and other forms of dementia can be quite debilitating, and the best thing that we can do is try to pick it up early and take preventative actions. Please, if you see any signs of Alzheimer's disease or dementia in your relatives or those you care about, please try to get them medical help as soon as possible. Thank you for joining me today on The Present Mind. I hope you found it very informative, and I'll see you again next time.